Okay, so an exanthem basically means a skin rash that arises from an area of an infection. It's a skin rash that arises from an area of an infection. Okay, and an anthem is a ulcerative lesion, usually located on the oropharyngeal mucosa. Oropharyngeal mucosa. Okay? So measles, also called rubeola. Measles, or the disease is called measles or rubeola, is caused by the measles virus, caused by the measles virus. The mode of transmission is the respiratory route. Mode of transmission is the respiratory route. Okay. Okay. The respiratory route. So this is a very, very contagious viral disease. It's a very contagious viral disease. Okay. And the way that this presents is that the presentation is basically you have a rash that appears with the fever together at the same time. A rash and the fever occur together simultaneously. Before the rash and the fever happen, there is a prodrome of symptoms. Prodrome of symptoms characterized by cough, chorea, which means runny nose, and complex spots. Now, complex spots are very, very characteristic for measles. And complex spots are identified on a physical exam as small red spots with a central blue-white specks. The complex spots are usually located inside the mouth on the buccal mucosa, Okay. And the patient population that are at risk of getting measles are basically children under 1 years old. Under 1 years old. Okay. Now, measles can be a big deal if it's not treated because it can cause complications. And the complications basically include middle ear infections, or encephalitis, middle ear infection or encephalitis. Okay. Let's see. This is a RNA virus. The measles virus is a RNA virus. RNA virus. And it's enveloped RNA virus. Enveloped RNA virus. It has a helical shape. It's a helical shape. And it's negative single-stranded RNA virus. These are complex spots found on the buccal mucosa. Now, rash usually starts on the face. The rash is described as a maculopapular blanching rash. And it progresses from a cranial to caudal fashion, meaning that it starts on the face first and it moves on. Okay, cranial caudal fashion starts on the face and then it moves down. The next one is rubella, which is German measles. Rubella is called German measles. This one also transmitted by respiratory routes. Also transmitted by respiratory routes. Okay. The presentation of this is that the patients start out with a high fever plus a red maculopapular rash occurring together with lymphadenopathy, usually in the occipital region. Occipital lymphadenopathy. Occipital lymphadenopathy. Okay? The rubella virus is a RNA virus. It's naked RNA virus. It has a positive sense. It's a positive sense single-stranded RNA virus with a isohedral capsid morphology. Take that back. It's actually enveloped. It's not naked. It's enveloped. Enveloped. Now, this one can cause a complication called congenital rubella syndrome. Okay, and this can affect basically congenital rubella syndrome affects the fetus when a woman or when the pregnant patient contracts rubella virus, especially during her first trimester of pregnancy. Especially during her first trimester of pregnancy. This can cause congenital rubella syndrome can cause deafness in the fetus or in the newborn. It can also cause patent ductus arteriosus, patent, which is a congenital heart condition. It can also cause retinopathy, cataracts, can cause stillbirth as well. So this is very serious, congenital rubella syndrome. Remember, especially if the mother acquires it during the first trimester.
Can you treat that?
You true not really at all the not at the no. You can only manage them, but you can't really treat. You can't reverse this.